day and welcome to On Your Health, your weekly program where we discuss on health issues and how it affects lives. I am your host, Immaculate Fogwe. Tonight we'll focus on hypertension, also known as high blood pressure. It is a silent condition that affects millions of people and can lead to serious health complications. And to answer questions on hypertension, I'll be receiving a cardiologist. She goes by the name Dr. ABANG SERAH. She's a cardiologist working at the Cabinet de Cardiologist, Cardio Plus, right here in the city of Douala. Good day, doctor. It's a pleasure to have you on the program.
Good day, and thank you so much for having me today.
On the 17th of May, we are going to be celebrating the International Day of Hypertension.
Exactly.
Can you tell us what hypertension is all about and why it's considered as a silent killer?
Hypertension is a common and dangerous condition where your blood pressure measured is above 140/90 millimeters of mercury. When I say high blood pressure is more than 140/90, you understand that whenever we talk about hypertension, we are dealing with two figures. You have the systolic blood pressure, which shouldn't be more than 140, and the diastolic blood pressure, which shouldn't be more than 90 millimeters of mercury. Understand that our body has arteries where blood flows, where oxygenated blood is carried to feed all our organs. When the blood pressure in these little tubes in our body is more than 140/90, then we have hypertension.
Why is it considered a silent killer?
Hypertension is considered a silent killer because, unfortunately, the majority of patients who have hypertension don't have any symptom at all. But even though they don't have any symptom, hypertension is slowly and silently destroying their organs. That's why it is called the silent killer, because some of the patients, the first time they'll be told that they have hypertension will be when they have stroke or a heart attack. That's why it's the silent killer. It doesn't make noise, but it's really terrible.
How common is hypertension in Cameroon?
30 to 40% of adult Cameroonians have hypertension. That's really alarming.
That's much.
It's alarming,
yeah,
isn't
exactly.
it? Yes. And the studies say it. Roughly 1 on 3 adult Cameroonians has hypertension. And the sad part about it all is that the majority of the patients who have hypertension don't even know that they have it. About 75% of patients with hypertension ignore their status. They are not aware of it. So it makes it again more dangerous. That means even those that even have the diagnosis, very few of them are controlled. That makes it really dangerous for the patients who have the condition. So don't think it's something that is just written there or just said for saying sake. 1 on 3 and more of Cameroonians have hypertension, and that is increasing in the urban areas, and as we age, it gets worse. Yes.
And for those who like to participate on today's edition of the program, here are the contacts: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Those are the numbers you can use to participate on today's edition of the program. If you're suffering with hypertension, then this is the right program for you to call and ask your questions. Back to you, doctor.
Right.
We want to know, you talked about hypertension. Is everyone at risk of suffering with hypertension, or there's a specific age group that suffers with this condition most?
We would say that the more you age, the more your probability of developing hypertension increases. And also there are a group of patients who are more at risk. For example, if you have family history of hypertension, let's say your father, your mother, your brothers and sisters already have hypertension, then you are at risk of developing hypertension. If you already have conditions like diabetes, your risk is increased. If maybe you are obese or you have some particular hormonal disorders, those ones also increase your risk of developing hypertension. If not, everybody is at risk. It's not a disease for the old. We have even young patients who come with hypertension.
Apart from these other complications of diabetes, hormones, are there other major causes of hypertension?
Yes. The major causes of hypertension are practically due to our lifestyle. Let's say it has to do with our diet, it has to do with our sleep, with stress. So let me list a little, some of the risk factors for hypertension. You have smoking. People who smoke have a higher probability of developing hypertension. You have smoking, you have obesity. If you don't do enough sports, let's say regular physical activities, you may develop hypertension. Stress is a direct risk factor for hypertension. So if you are stressed up, you don't sleep well, you don't exercise, you are obese or overweight, and then most importantly, the way you eat. If you consume a lot of salt and you don't consume, let's say, potassium-rich food, which can help to eliminate the sodium in your body, your probability of developing hypertension is high.
I want us to focus on stress.
Yes.
Especially in a cosmopolitan town like a city like Douala, where life can be so stressful, from work to your daily chores to everything. How can you prevent yourself from being stressed with all what is happening in our society today?
I think the first thing, just knowing that being stressed up is a risk factor for cardiovascular diseases, it will help the patient to know that I have to go very slow on it. I have to be careful how much I let myself being stressed. And when we give the prevalence of hypertension, let's note that in the urban areas, it's higher. So there are more hypertensive patients in the big cities than in the villages. And that's why, because of the lifestyle that we have in the cities, where we are always on the run, always no time to rest. So how can we help to reduce stress? It's clear that there are many things that we let stress us that we could really avoid. That is for sure. There are other things in the day-to-day life that you cannot stop, maybe like finances, like when you have health issues, let's say. But sometimes we don't take time to rest. We have 1,000 activities. People have 10 meetings. They have to attend all funerals. They have to attend all activities. And that makes it such a way that people don't take time to rest again. You might have a very complicated job, but you have to create time. That little time that is set aside for you to rest, use it wisely and take time for yourself. Eat healthy. Make sure you sleep. How many times we find ourselves sleeping with the phones? We have to force ourselves to sleep nowadays. People don't take time to sleep, and sleep is extremely important.
I think we have a caller. We'll come back to that stress. Hello, good afternoon.
Hello, good afternoon.
Good afternoon.
Your name, where you're calling from, and your question, please. Hello, can you get me? Hello? Okay, please, whenever you try to participate on today's program, make sure that you turn off your radio and TV sets before going about with your question, because when it's turned on, we can't get you clearly. So we're talking about stress and how it can definitely have a great impact on a human being as far as hypertension is concerned.
When a patient is stressed up, some certain hormones are produced which can make your heart go faster, which can make your arteries to constrict, and that can increase your blood pressure. So whenever we are stressed up persistently, that could contribute to increase blood pressure. And we know that people that are stressed don't sleep well. They have a tendency to not eat correctly. They might go for junk food. When you are very stressed, you are prone to take more alcohol, to even smoke. So being stressed up really brings other things which can add up to the stress and increase your probability of developing hypertension. So it's extremely important to try to be zen, try to relax. Yes, it's important.
Even though sometimes it's very difficult to be relaxed in the midst of all these challenges that we face on a daily basis.
It's really true, but we have to make that extra effort because it's a risk factor which cannot be undermined. We see even in our consultations many patients who are going through anxiety and depression. Unfortunately, in our context, anxiety and depression is really minimalized. People don't take it seriously, but people are going through very difficult conditions. And of course, we try to advise patients to seek help with psychologists when necessary, not to carry the burden alone, because sometimes we can end up in very difficult conditions when we are not accompanied, when we are going through difficult moments.
And how dangerous can uncontrolled hypertension become? We have a call on the line. We'll come back to that question. Hello?
Yeah, hello. Good afternoon, madam.
Good afternoon, sir.
Good afternoon, madam.
Yes, sir. Good afternoon. Your name, where you're calling from, and your question, please. Okay. Your name?
Yes, Ezekiel. I have a problem. I don't sleep well in the night. So I don't know what to do. Of course, I'm getting the program.
You don't sleep well. Have you visited the hospital?
I have a problem. I don't sleep well in the night.
Okay.
Okay.
All right.
Yes.
Now, not sleeping well in the night is there may be many reasons why you don't sleep well at night. Now, there is one other condition which is called sleep apnea, which is a direct risk factor for hypertension. If you have sleep issues, if maybe during the day you wake up and then you realize that you have not really rested, you have to ask your partner if maybe you snore a lot at night. Even those who don't snore, if you have a difficult sleep, if you snore, if you are overweight, and during the day you have the tendency of always wanting to catch a nap during the day, make sure you discuss that with your doctor. Maybe you could have a sleep apnea, which is a condition where during the night you practically stop breathing, you are not aware of it, and you stay for minutes without breathing, and that can make it such a way that your brain is not oxygenated, and then during the day you are in difficulties. That can increase hypertension.
We have another call on the line. Hello.
Hello, good afternoon.
Good afternoon, madam. Your name, where you're calling from, and your question, please. I can't get you clearly.
I'm calling from here.
Okay, go ahead, Madam Patience.
Last 2 weeks ago, I went to the hospital to check on my eyes. But on taking my blood pressure, they realized it was really high. So I ran a series of tests and was prescribed some drugs. But the problem is, my question is, the drugs are giving me a terrible headache and I'm feeling dizzy. I don't know if it's normal.
What is the name of the drugs? Maybe she may want to know.
I'm taking atorvastatin.
Okay, I think
one complement,
you know about it?
alopamide. Those are the two drugs I'm taking. But it's serious. I'm having serious headache.
Okay, thank you so much.
I'm feeling dizzy, so I don't know if it's normal.
Okay, doctor will be answering you now.
All right.
Thank you very much.
Yeah, thank you, madam, for the question. When a patient has hypertension and is put on treatment, we have various classes of medications for hypertension. Now, when the medical doctor or the health personnel puts you on treatment, it could happen that you develop some side effects due to the medication, but don't panic. Just get back to your health personnel, explain how you're feeling, and they might give you another class which will help you with your hypertension. So don't worry, it can happen that you have headache after you start a medication for hypertension, because that particular class of medication you are taking for hypertension can give headache. It could happen. So you go back to your health personnel, then they will give you another medication for hypertension. Most importantly, don't take it on yourself to stop the medication. Go back to your health personnel. They will see what to do. They will change it, give you something else, and then you'll see that you'll be fine. Yeah.
And now, how dangerous can uncontrolled hypertension become?
If your blood pressure is not well controlled, you have the risk to develop complications for hypertension. I always tell my patients that
we have another call on the line. Hello.
Hello, good afternoon.
Good afternoon, madam.
I am called Julian Shah. I'm calling from Kwibi.
Okay, madam. Julian.
Yes, I wish to ask if it's possible that someone that is having around 110, then after some time the person moves on to 117.
Okay. In a space of how long?
I don't know, because I had two people that I know close to me, my family members, that they were having around 110, 111. Usually when they go to the hospital, they usually take their blood pressure.
Yes.
Then after some time, they were having a normal sickness. Maybe, I don't know, maybe malaria. They went to the hospital and they told them that they have hypertension because their blood pressure was 117.
170.
117 over something like that.
Okay, va bene. All right.
Yes, so the question is, because I'm a sister to the person.
You wanted to understand, yeah. Okay.
Yes, I wish I am like also having the same problem, 110. I've never had 120 as they usually say is normal. So
okay, so you want to know why? Is that so?
Yes,
Okay.
I wish to know why.
All right. Okay. So blood pressure varies throughout the day. You will never have the same value. Even if you measure your blood pressure at 10 o'clock, at 10:15, the value could be different. It changes.
Okay.
Yes. It varies throughout the day. In the morning when we wake up, in the afternoon, depending on the activity that we are doing. So you could be at home and you have a blood pressure of 110, as she said, and then you go to the hospital. I guess she said 117. But really, between 110 and 117, we are practically around the same values. That's why I thought she said 170.
Yeah.
Because it can happen in some patients that when they are at home with their own blood pressure machine, they have normal blood pressure. But when they go to the hospital, the blood pressure is very high. That is what we call white coat hypertension. That is, the patient, when he gets to the hospital, because of the fear, the anxiety due to the hospital context, it can make the blood pressure to be elevated.
I think we have another call on the
caller.
line. Yes,
Okay.
hello.
Yeah, hello, madam. Good afternoon.
Good afternoon, sir.
Yes, I'm Chef Day calling from Yaoundé.
Okay. Go ahead.
Yeah. The doctor just discussed about a problem that I think I'm concerned with that problem. Yeah, concerning sleeping at night. That when you don't sleep well at night, you get up in the morning, you like snore, you are like feel like
Tired.
early in the morning, you feel like it's sleeping or snapping like
Exactly. Yeah.
Yeah. So if it's for snoring, really, I snore a lot at night. My wife has
Complaint.
about concerning about snoring.
Yeah.
That I really snore at night, and like doctor just mentioned that it might be at times it's like I don't breathe well, or I don't breathe even for some minutes.
Exactly.
Yeah, I think I'm really concerned. So I don't know if I can have some advice from how what to do.
Okay. Thank you so much for participating. Okay, doctor.
Right. Yes, some patients have sleep apnea. And when we have that suspicion, it's very important to go to the hospital. There is a test that can be done, which is not painful. They will put some apparatus on you. You will sleep. Depending on what we want to check, you might just take the apparatus home, spend a night with it. It will measure a lot of information and tell us if you really have the sleep apnea or not. In some cases, you might have to sleep in the hospital to do that test for a night. After, if it is diagnosed, you'll be given a machine with which you'll be sleeping that will help your breathing. It's important to have this diagnosis because it's one of the causes of road accidents, because these patients with sleep apnea, during the day, they are so sleepy that they could easily make an accident when they are driving. So if you have the symptoms of easy fatigue during the day, you feel go to your health personnel and ask and say you want to do a test to exclude sleep apnea.
Though we have another call on the line. Hello.
Okay.
Hello, good afternoon, all of you in the panel.
Good afternoon.
Good afternoon.
Sir.
I'm George calling from Bonaberi.
Okay, sir.
Yeah.
Thank you in advance for the initiative.
Okay, sir.
I have problem. Allow me to follow in French.
Okay,
go ahead.
Monsieur.
Ok, bon, mon problème c'est que je suis déjà sous traitement d'hypertension et de manque de sommeil.
Okay.
Bon, mais je voudrais savoir, il m'arrive les matins quand je me réveille, parfois que je n'ai pas bien dormi la nuit, la tension est normale, ça dit que entre 11 et 13 par là.
Okay.
Mais parfois, il y a des nuits où je dors bien, mais la tension est tellement élevée, en dessus de 14, 15. Bon, je ne comprends pas, trop pourquoi.
Ok.
Ok. Merci d'avoir participé au programme, monsieur.
Donc, quand le patient est déjà sous traitement pour l'hypertension artérielle et puis on se rend compte que souvent les chiffres ne sont pas vraiment comme on voudrait, c'est important de rentrer chez le médecin. On pourra faire ce qu'on appelle la MAPA, qui est la mesure ambulatoire de la pression artérielle. C'est un examen qu'on va vous mettre le tensiomètre sur 24 heures, qui va mesurer votre tension de jour comme de nuit, comme vous dormez, et ça nous donne des informations utiles pour qu'on puisse savoir réellement comment votre tension se comporte sur les 24 heures. Après cet examen, on saura s'il faut mettre certains de vos médicaments le soir au lieu de mettre exclusivement le matin. Donc, vous pouvez rentrer voir votre cardiologue. Oui.
Now we're talking about how dangerous can uncontrolled hypertension become.
if blood pressure is not well controlled, it can give you a series of complications. So as I was saying, I tell my patients that the complications for hypertension are from head to toe, because we start from the head. Hypertension can give you a stroke, can give you problems with your eyes, and it can even give dementia. So there's growing evidence that hypertension is the cause of dementia. Now, hypertension can give you, at the level of your heart, it can give you a heart attack, it can give you heart failure. Hypertension is the first cause of heart failure in Cameroon. So it's extremely important that your blood pressure should be controlled. Hypertension can give kidney failure. Patients are usually afraid to take medications because they say maybe the medications can give them kidney failure. Instead, the error is not to take your medications. If you don't take your medications and your blood pressure remains uncontrolled, you might have kidney failure. Hypertension can give erectile dysfunction. There are some men that have difficulties to conclude, and that could be because they have hypertension. It can disturb even the arteries of your legs. So at all levels of our body, hypertension is can give us some terrible complications. So it's extremely important that, one, that you try to get diagnosed, go and measure your blood pressure. Number two, if then they see that your blood pressure is high, listen to what your doctors tell you. Take your medications in order to avoid the complications.
Once diagnosed with hypertension, will you have to take drugs for the rest of your life?
That's a crucial question. And patients always want to know if they will need to take the medications for life. So now we are on Equinoxe, let's say it today.
Yes.
When you are diagnosed of hypertension, you will need to take your medications for life, because we don't cure hypertension, we manage it. So it's important that when you have the diagnosis, your doctor prescribes the medication. Know it that you have to take the medications for life. They have not yet invented the medication that you can take once in a month or once in a year. So every medication needs to be taken once every day, preferably at the same time, to get your hypertension well controlled. Don't stop your medication without talking to your health personnel, please.
Thank you so much for accepting my invitation on today's program.
You're welcome.
We had so many calls and we couldn't take more calls again.
Exactly.
We had more calls, but then
Exactly.
we want to thank all those who participated on today's edition of the program. As guest, I had Dr. ABANG SERAH. She's a cardiologist working at Cabinet de Cardiologie, Cardio Plus, right here in the city of Douala. And I received technical assistance from Jonathan Babula and Bertrand Bonzini. From me right here to you over there, thank you so much for watching and listening to the program on radio. Have a wonderful day in the company of interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.